Hello everyone and welcome to this video lecture on hypertension. It is a critical topic for your AMC 1 preparation. In this lecture we'll try to cover from its types and classification, to diagnosis, management, and the specific Australian guidelines that are essential for both the exam and clinical practice. Hypertension, or high blood pressure, is one of the most common conditions you'll encounter as a doctor. It's a major risk factor for cardiovascular diseases. Understanding how to diagnose and manage hypertension effectively is crucial. So let's dive in. Hypertension mainly classified into primary hypertension and secondary hypertension. Other than that, we must know about other types of hypertension, like white coat hypertension, isolated hypertension, refractory hypertension, and most important one, hypertension, emergency, and urgency. You must know how to differentiate these two conditions from each other, that we will discuss further in detail later at the end of the topic. So let's start from primary hypertension. Primary hypertension, or essential hypertension, it is the most common type of hypertension, accounting for 90 to 95% of cases. It has no identifiable cause. Secondary hypertension. This occurs when high blood pressure is caused by an underlying condition, like thyroid disease, renal artery stenosis, aortic coarctation, Cushing syndrome, kidney disease, pheochromocytoma, aldosteronism, drug-induced and sleep apnea. Mnemonic trackpads will help you to remember causes of secondary hypertension. Especially remember renal artery stenosis, pheochromocytoma, and hyperaldosteronism. These are frequently tested in exam. White coat hypertension. Elevated BP in clinical settings due to anxiety, but usually it's normal in a place like home or office. To diagnose this condition, we use ambulatory blood pressure monitoring. You must be thinking, what is this ambulatory blood pressure monitoring, right? It's a small device that allows us to monitor blood pressure for 24 hours. This small machine helps us to confirm diagnoses like white coat hypertension, resistant hypertension, or episodic hypertension, for example, pheochromocytoma. It measures BP every 15-20 minutes during the day and 30-60 minutes at night. Now, what is isolated systolic hypertension? When only systolic hypertension is high, but diastolic blood pressure remains normal. For example, systolic blood pressure is 150, and diastolic blood pressure is 85. Here you can see only systolic blood pressure is increased, which is more than 140, and diastolic is below 90. That is perfect example of isolated systolic hypertension. Now the last but not least, refractory hypertension, in which blood pressure remains more than 140/90 despite treatment with 3 or more medications. Hypertension categorizes into grade 1, 2, and 3 based on systolic and diastolic pressure, that you can clearly see in this table. As per guideline, blood pressure more than 140/90 count as hypertension. I'll give one case where I want you to give me the correct answer. So there is a patient with a blood pressure of 150/105. So what grade of hypertension this patient has? Systolic blood pressure 150, that falls in grade 1 category, but 105 that is grade 2 category as per this table. So which grade will you choose? So remember the rule, we always go for the higher category, and that is grade 2. Now, how to diagnose hypertension? Diagnosis should not be made on the basis of a single visit. To diagnose hypertension, higher blood pressure must be recorded in at least 3 visits within 3 months of intervals. Blood pressure must be above 140 for systolic or more than 90 for diastolic are needed to diagnose hypertension. This will avoid the possibility of an incorrect diagnosis. And remember, medical history is always important while making a diagnosis, like family history, alcohol consumption, contraceptive use, etc. Treatment strategy for patients with newly diagnosed hypertension is the most important thing that you should know. First, see if the patient is at risk of cardiovascular disease or not. If you don't know how to do cardiovascular risk assessment, then go and watch this video. In cardiovascular risk assessment, we categorize them into low, moderate, and high risk. Then our first goal is to advise lifestyle modification, and if still patent blood pressure remains higher than 140/90, then we will start them with a single drug at a low dose. I won't give a detailed explanation of this chart, but you must read this chart once. I will put a link in the description, so please go and check it out. After prescribing antihypertensive drugs, it takes 4 to 6 weeks for the effect to fully appear. Now, one quick question. Pause the video and read the question carefully and then answer it. So the correct answer is B, ambulatory blood pressure monitoring. Ambulatory blood pressure recording is required before proceeding for investigations for secondary hypertension. It will help in excluding white coat hypertension. Once white coat hypertension has been excluded, then consider doing investigations for secondary hypertension, such as renal artery ultrasound, urinary metanephrine levels, aldosterone, renin ratio, etc. That is all for today. Thank you for watching this video. In the next lecture, I will give you more information on what drugs should be used to control high blood pressure. So goodbye for today. See you in the next video. And please like, share and subscribe for more videos on AMC1 Prep Series.